NHS South Tees Clinical Commissioning Group, or CCG, is proud to be supporting Patient Participation Awareness Week. NHS South Tees CCG commissions or buys health services for the local population of Middlesbrough and Redcar and Cleveland. Services the CCG commissions or buys include urgent and emergency care, planned hospital care such as operations, community services, rehabilitation, maternity, newborn and children and young people's services, mental health services, continuing healthcare or CHC for people with ongoing health needs such as nursing care, and GP services. The CCG are passionate about involving local people and patients in their work. PPGs are a route for patients to advise and inform their GP practice on what matters most to patients. PPGs tend to be set up by practices, but over time they are usually run by the patients. It has been a contractual requirement that all English practices form a patient participation group since 2016. Some PPGs meet face-to-face, whilst others are held virtually or online.
People often ask, why is patient involvement so important to the CCG? Really good question. And it goes back to the basics of the people who are actually going to be using the services that we're developing and planning and buying and reviewing are the patients who actually do use the services, or their carers or other family members. So it's really important that we listen to what people who actually use the services have experienced, how they found the service and how it felt for them, because that helps us to make sure that when we are developing new services or improving existing services, that we actually know how it impacts those patients that the services are devised for. We can get really rich, valuable data from getting that patient feedback. People can be so honest as to what they tell us, and that's what we need. But then most importantly, it's how we use what they tell us to develop and improve new services.
NHS South Tees CCG have developed this video with local PPGs to share examples of their work. The following case studies are from Saltscar Practice, the Greenhouse Practice, Colby Medical Practice and Borough Road and Nunthorpe Medical Practice. Borough Road and Nunthorpe PPG, or Patient Forum, has been established since January 2012. The group comprises of volunteer patients, GPs, the practice manager and admin staff. The key purpose of the PPG is for the patients and staff to work together in unison to optimise the provision of patient needs. The Borough Road and Nunthorpe Patient Forum is an active, dynamic group totally committed to the success of the practice. The key achievements of the Patient Forum include promoting the existence and visibility of the forum within the practice, the introduction of meet and greet sessions at the surgery. This includes randomly selecting patients to be interviewed informally on a one-to-one basis. The results of this are then fed back to the staff for analysis. Members of the forum are sometimes requested by the practice to participate in support activities, for example, attendance at meetings with the local authority, promotion of the use of digital services via the newsletter, social media and the website. Additionally, the practice and the PPG have received numerous complimentary comments received from patients regarding improvements made to the practice as a direct result of actions initiated by the patient group.
Hello, my name is Jerry Hart. I am the Chair of the Patients Participation Group at Colby Medical Practice. Our PPG is patient-led group and our meetings are held quarterly within the practice. We advertise our PPG in our practice website, the practice newsletter and also on the notice boards within the practice. Our PPG has been running now for 6 years, and although we have an established group of patients, we are always trying to recruit new members of different age groups and backgrounds in order for them to contribute in different ways. Since the PPG has been operating, we have made a number of achievements by holding raffles to raise money to purchase a high back chair for the waiting area. PPG members volunteer to hold meet and greet sessions within the patient's practice, and this gives us an opportunity to advertise the PPG and to try and recruit new members. We've also invited speakers to attend the PPG meetings to talk about their work. For example, we've had representatives from Aging Better and Health Watch. Overall, the PPG aim is to improve the patient experience within the practice.
The Greenhouse Surgery Patient Participation Group. The group currently consists of 8 members meeting monthly. Agendas are agreed in advance, which include a number of fixed agenda items, including updates on friends and family test and updates on forums attended by members. PPG provides a friendly ear to patients who have any concerns. The members assist in annual flu clinics and hold drop-in sessions. The group produces a quarterly newsletter that is made available to patients. Salt scar practice.
As well as getting patient feedback about the services that we provide in practice, the PPGs do a lot of really helpful, useful other things as well. I know many do practice newsletters, I know many help with health promotion campaigns, many support surgeries with their flu campaigns, which I know can make things run much more smoothly. Patient participation groups are a really valuable way of getting feedback about the services that we deliver in practice. It's a way that we hear about the good, the bad or the ugly sometimes, but in a constructive way. The patients that are involved with patient participation groups are willing to be very honest with us about how they feel services are working or not working. But actually they do an awful lot more other than just feeding back. They give useful, helpful suggestions as to how we can improve things, making changes that practice can and do put into place. Sometimes it's small things. In our surgery, they very helpfully gave us advice about how we could have a fisheye mirror on the way into the surgery that made it so much safer for people getting in and out with cars and indeed pedestrians. But it's often the big things as well, the things that can make such a difference to how people find it easier to access the surgery. Our patients have been very supportive that patients who are able to self-care should be encouraged to do so, and that we should all share that responsibility in keeping a well-stocked first aid cupboard at home to manage some of the simple conditions ourselves, rather than putting demands on resources that we don't need to do. And it's been really, really valuable to actually get that backup and support that yes, what we are wanting to do is what patients think we should all be doing.
There are many ways to be involved with the CCG. Why not visit our website at www.southteesccg.nhs.uk. You may already be a member of your own PPG, but if not, and you want to find out more, why not ask in your practice next time you're there? If you are a member of a PPG in South Tees, which is Middlesbrough and Redcar and Cleveland, and would be keen to be involved in the PPG collective group that the CCG holds, then please get in touch with the CCG on 01642 263030. Thank you to everybody that contributed to this video.